With the rise of information technology, the world of healthcare is being personalized, mobilized, and transformed. This has significant implications about how our wishes at end of life are communicated to our healthcare providers. Hi, I'm David Simmons, a Master's of Health Administration student at Penn State University, Harrisburg, and I want to talk about the importance of including advanced directives in the health information exchange. Technology has the power to connect us to our doctors, warn us of changes in our health, manage chronic diseases, and help us engage activities that will keep us healthy. Essential to harnessing the power of technology is to connect vital patient health information across the healthcare system in a way that is secure, private, and instantaneous. This is often referred to as HIE, or Health Information Exchange. The ability of multiple systems to communicate this information across compatible information platforms is known as interoperability. According to the National Coordinator for Health Information Technology, this electronic health information exchange allows healthcare providers and patients to appropriately access and securely share a patient's vital medical information electronically to improve quality, safety, and the cost of patients' care. It is important that in this exchange, we also include a patient's advance directive. An advance directive is the documentation of a patient's healthcare wishes should they face a terminal condition and are unable to speak for themselves. The advance directive flows from critical conversations between patients and their doctors and their loved ones. Patients identify their wishes and then designate a healthcare power of attorney to speak for them when they can no longer speak for themselves. Yet often, a patient's advance directive is not easily accessible by providers when they are needed most. But through interoperability of the health information exchange, they can be. Why is timely access to a patient's wishes important? Advance directives contribute to two important trends in healthcare. That is patient-centeredness and value-based care. With regards to patient-centeredness, advance directives ensure that patients receive only the treatment that they desire during the most critical moments of their lives. It also contributes to value-based care, since healthcare costs in the last year of life represent 1% of our nation's GDP and over $55 billion Medicare dollars in just the last 2 months of life. Advanced directives reduce costs, since studies show that when patients engage the advanced care planning process, they are less likely to choose aggressive and costly measures when those interventions are no longer likely to prolong life. One way in which advanced directives can be communicated across health systems is through state and regional initiatives to link together health information organizations through a hub and spoke-like structure, where patients may be able to opt in or out of this health information exchange. In this more traditional structure, patients' healthcare wishes can be transferred easily from provider to provider. But even as states and healthcare organizations move forward in their efforts to exchange health information, the private sector may preempt these efforts by providing solutions of its own. Take AdVault, for example. This Dallas, Texas-based company utilizes an Apple-compatible mobile application called My Directives to allow users to generate personalized messages about their medical wishes. Patients can update their advanced directives at any time in real time. Furthermore, these cloud-based advanced directives move beyond checkboxes of traditional advanced directives to something more personal and meaningful to family and to providers. AdVault has already established partnerships with several healthcare organizations so that these mobile applications can interface with the patient's medical record. We should expect other companies to follow suit in this much-needed open market. In the meantime, what can you do? It is important that leaders in the healthcare system first understand the value of an advanced directive to patient-centered care and value-based healthcare systems. Second, healthcare leaders must develop processes within their healthcare system to encourage, solicit, obtain, and store those healthcare directives. And then lastly, healthcare leaders must engage their IT departments to include the patient's advanced directives in the health information exchange. Patient-centered care in a value-based system depends on the communication of patients' wishes, from hospital to the rehab center to the primary care doctor to the nursing home, no matter where the patient receives their care. For this is not just effective care, it's compassionate care. Thank you for watching.